Hi students, you are welcome to Angel Health Academy. Topic for the day is levels of health care. Levels of health care. So let us introduce the topic of the day, that is levels of health care. Health care is a multitude of services rendered to individual, families or communities by the agent of health services or professions for the purpose of promoting, maintaining, monitoring or restoring health. So health care. So Government of India has a responsibility to render the health care services to its citizen or to the public. This health care is a multitude of services. So it consists of a group of services, a multitude of services, usually rendered or delivered to individual, family or communities in the society by, that means it is done by the agent of health services or agent of health professions. So that is simply health personnel or health workers. They are called agent of health services for the purpose of or with the objectives of promoting the health, maintaining the health of these individual families or communities or to the public, or monitoring their health and restoring or bringing back to the normal state of health, restoring the health of the individual families or communities or our citizen. So in short, health care is a multitude of services that is rendered by the agent of health services for the purpose of promoting, maintaining, monitoring or restoring their health. Next is the goal of health care. So the goal or purpose of health care we are already mentioned, but the goal of health care is the health development, that is health promotion of our citizen, health promotion of the public, health promotion of the individual, family or community. So health promotion or health development is, that is nothing but it is a process of continuous and progressive improvement of the health status or health condition of the population or individual, family, community. So the goal of health care is health development or health promotion, promoting the health of the people, promoting the health of the population. That is, or that means it is a process. Process means a series of steps. It is a process of continuous and progressive, that is step by step improving, progressive improvement of the health status or health condition of the population or citizen. To achieve this goal, healthcare services are usually organized at 3 levels. So to achieve the goal of healthcare services in India are organized at 3 levels. That is primary, secondary and tertiary levels. Each levels are supported by a higher level. That is secondary level support the primary level, tertiary level support the secondary level. So each levels are supported by a higher level to which the clients are referred. The client is referred, the patient is referred, the individual is referred, transferred. Okay. So to achieve this goal, healthcare services are usually organized or classified into 3 levels, and each of these 3 levels are supported by the top level, by a higher level to which the person is referred or transferred. So let us see what are the levels of healthcare or classification of healthcare. So as we are already mentioned, there are 3 levels of care, that is primary care, secondary care or tertiary care, or primary level of care, secondary level of care or tertiary care of level. Thus level of health care includes primary health care, secondary health care and tertiary health care. So let us discuss one by one what is primary level of care, secondary level of care and tertiary level of care. First is primary level of health care or primary health care. Primary health care is the first level of health care. That means it is the first level of contact of individual, family and community with our Government of India's national health care delivery system. So it is the first contact of the people or individual to the health care system. So it is the first level of contact of individual, family and community with the national healthcare delivery system. Through this healthcare delivery system, Government of India deliver or render the health services at free of cost to the public, where primary healthcare is provided. So primary healthcare is provided in healthcare delivery system. So it is the first level of contact of individual, family and community to the national healthcare delivery system where they can avail the primary healthcare. That means it is the first level of contact between community and healthcare providers or health agencies. Healthcare providers are nothing but it is the healthcare workers in India, government healthcare workers. So healthcare providers at grassroots level. Grassroots level means peripheral level, at community level. So it is the first level of contact between community and healthcare providers at grassroots level. Grassroots level means peripheral level, community level, village level, at doorstep. That will come under grassroots level. Primary level of healthcare is also called as an essential healthcare. It is very essential to the public, very essential to the individual, family and community. So it is also called as an essential healthcare or healthcare at their doorstep. So here the healthcare personnels, health workers going to the house of the or home of the particular individual, family and community in the community setting and rendering the health services. That is called it is an essential healthcare or healthcare at their doorstep, their own doorstep. The features of primary healthcare services include, first one is it is a comprehensive in nature. That means it includes all that is physical, mental, social, spiritual, all the type of services. Educational, nutritional, etc. So comprehensive in nature. Then it is very close to the people. We are already mentioned it is their doorstep. The services is available at their doorstep. So very close to the people, and it includes the basic health care. That is the essential health care. So primary health care include basic health care services and the measures of health promotion and prevention. Health promotion and health prevention are the main focus of the primary health care services. So the features includes comprehensive in nature, very close to the people. It includes basic healthcare services and it focuses the measures of health promotion and health prevention. Moreover, in this primary healthcare services, peoples are made self-reliant. So peoples are made to render or able to do self-care services or do the services for their family members. So moreover, primary health care services includes or that make the people as self-reliant. That means they are able to do self-care whenever it is necessary. At this stage, many of the health problems are solved by the people themselves. That means when the people started to do self-care, most of the problems or many of the problems they can solve by themselves. So by the people themselves with some guidance. They need some guidance from the health personnel or health workers. They need some education. And they need some assistance, help that is provided by the community health team available in the community settings. So they need some guidance from the health personnel, some education, health education from the or awareness from the health workers, and some assistance or help from the health worker or the health worker belongs to the particular community health team. With that, they solve many health problems by themselves. Then it provided at a village level. So primary health care is provided at a village level and through primary health centers level and their sub-centers level. So primary health center, one primary health center consists of 6 sub-centers. That means primary health center level and sub-center level through the agency of health professionals or agency of health workers. So primary health care make the people self-reliant, and because of they are self-reliant, they can solve many of their health problems with a very small amount of guidance, education and support or assistance from the community health team. And usually this primary health care or primary level health care is provided at village level and from primary health center level at primary health center level and at sub-center level by the health agency or health professionals. At village level, primary health care is provided by Village Health Guide, VHG, Anganwadi Worker, AWW, Trained DICE. Trained DICE is also called Traditional Birth Attendant. Trained DICE means those who are attending the delivery at community settings. Those people are called DICE. So, DICE are given special training. Trained people are called Trained DICE. So, they also called as Traditional Birth Attendant. They attended the birth traditionally at community level. Then ASHA worker. The expansion of ASHA is accredited social health activist. So ASHA workers also render the primary health care at village level and other community leaders available in the community. are active in contributing their services at primary level of healthcare to the public. Then at primary health center level, it is given by or it is rendered by medical officer of the primary health center, community health nurse of the primary health center, health supervisors or health inspectors of the, that is HI, of the primary health center, and junior public health nurse, JPHN, or the health worker male or female or multi-purpose health worker and others. These are the staff of the primary health center who render the primary health care services to the or primary level health care to the public. Then at sub-center level, it is given by the multi-purpose health worker, that is MPHW, male and female health worker, or junior public health nurses or JPHN at the sub-center level. So this is about the primary level of health care. The second level of health care is secondary level of health care. So second level of health care is secondary level of health care. Let us see what is the meaning of secondary level of health care. The primary levels of health care settings or primary health agencies are not equipped with all the facilities. That means primary health care level, its settings, government settings or health agencies do not have all the facilities and equipments. And even manpower. Manpower is nothing but health personnel or health workers. So primary level healthcare setting or health agencies are not equipped with all the facilities and manpower to deal with more complex health problems. So health problems, there are simple problems are there, moderate problems are there, severe problems are there. In that severe and moderate problems cannot deal at primary level healthcare because it has less equipment and less facilities and less healthcare workers. So it is not able to deal with the more complex health problems, hence which require secondary level of preventive services. That means people are required, individual, family and community required secondary level of preventive services. It includes special diagnostic services, curative services, specialist consultations with specialist doctors like pediatrics, gynecology, etc. All comes under specialist consultations. These services are referred as secondary level of services or secondary level of health care. So, in short, that is primary level of healthcare setting or health agencies are not equipped with all the facilities and manpower, health personnel to deal with more complex health problems. So, to deal the more complex health problems, it requires secondary level of preventive services. That means diagnostic, curative and specialist consultation services, etc. is called or are called secondary level of healthcare. That means the next higher level of healthcare, that is from primary healthcare level, next higher level of healthcare is secondary healthcare level or intermediate healthcare level. Secondary healthcare level also called as intermediate healthcare level. Here mainly focus the curative services, or the curative services are provided mostly at this level, that is secondary level or intermediate healthcare level. Then secondary level of healthcare services are mainly provided by or provided at community health centers, CHCs. Each block may have one community health centers, and one community health center covers 80,000 to 1,20,000 population. So community health centers. Then taluka headquarters hospitals. So each taluk there will be taluk headquarters hospitals, and the district, some of the district in India are divided into sub districts. There we have hospital facilities, that is called sub-divisional hospitals. So secondary level of healthcare services is rendered by, delivered by or provided at community health centers, taluka headquarters hospitals and sub-divisional hospitals. Then community health center, also known as, or it is a 30-bedded rural hospitals. Community health center means it is a 30-bedded rural hospital. In addition to that, community health center serve as the first referral unit. So community health center is called as the first referral unit or first referral level of health care. That is, people from patient from sub-centers and primary health centers are first referred to community health center for the secondary care services. So community health center serve as the first referral unit. Community health center is also known as first referral unit for the health services to the people from sub-centers and primary health centers. So for the higher facilities, for the more complex problems, the patients can be transferred or referred to the CHC from sub-centers and primary health centers. Thus, CHC is considered as the first referral unit, which provides the secondary healthcare services to the patient. Last one is tertiary level of healthcare. The third one is tertiary level of healthcare. The health problems which cannot be treated at secondary level care settings or health agencies are dealt in tertiary level of healthcare settings or tertiary level healthcare agencies. Then these institutions, that means tertiary level healthcare institution, serve as the referral unit for both the primary and secondary level of care. So from primary level also people can be or patient can be transferred to the tertiary level, or from secondary level also patient can be transferred to the tertiary level. So it is the referral unit both for the primary healthcare settings and secondary healthcare settings. In these institutions, the latest technology is available, latest facilities are available, all manpower and super specialists also available. So in the secondary healthcare settings, the latest technology, latest equipment, latest facilities, so it would be well equipped to render all the levels of health services. Thus, tertiary level is a more specialized, specific facilities and more attentions of highly specialized health workers. All the complex health problems are treated at tertiary level. Then tertiary level of health care is provided by or provided at district level, that is district hospital, by district hospitals, at regional level, by state level, okay, that is by medical college hospitals, then central level or national level with the national institutions. They provide under the services, that is tertiary levels of health care. That includes the specialty hospitals, medical college hospitals, super specialty hospitals, etc. So tertiary level care is done by specialty hospitals, medical college hospitals and super specialty hospitals at district level, regional level and central level or national level. These institutions, that is tertiary level institutions, in addition to provide tertiary level of healthcare to the public, they serve as the teaching institutions. So all these tertiary institutions are teaching institutions. They may have different the nursing related or health related, medical related courses. Like medical college, they provide medical education, dental education, nursing education, paramedical education, etc. So all those tertiary institutions act or serve as a teaching institutions. So they called teaching hospitals. Moreover, they have a training program for all the health level of health personnel or health workers. Then they provide medical education to the various categories of health personnel or health workers. So training and medical education for the health personnel or health workers. Then moreover, they have a planning, health management, various health related research work, all executed, all done at this tertiary level. Now you can see a flow chart that is about the levels of health care and referral services. Levels of health care and referral services. Now there are three levels of health care, that is primary level, secondary level and tertiary level. Now you know that primary health care level is done at a village level. Then secondary level care is done at block level and taluka level. Tertiary health care services is done at district level, state level and national level. So at village level, it is done by healthcare services is done by the community health workers like village health guide, Anganwadi worker, traditional birth attendant, Asha workers, etc. Then people will avail the services from the sub-centers and primary health centers, all primary level of health care. Then from primary health center or sub-center, patient is transferred to or referred to the secondary level for the secondary level of health care, that is CHC, community health center. Then Taluka headquarters hospital, subdivisional hospitals, where the people can avail the secondary level of health care, that is at block level and Taluka level. Then third reference is that is from CHC, Taluka headquarters hospital, subdivisional hospitals to district hospital for the tertiary level of health care. So district level from district hospitals, state level from regional hospitals or medical college hospitals, and national level from national hospitals. So that includes many super specialty and multi super specialty and referral hospitals. So one of the example of the tertiary care referral hospital and research center is that is JIPMER. You can see the JIPMER Academic Center that is in Pondicherry. So that is run by the central government fund. So this institution is considered as the referral hospital and research center at a national level, which are under the tertiary healthcare services. So that is about the tertiary level of health care. Now we have completed a primary, secondary and tertiary level of health care. So thanks for watching. Hope this video really benefits in your studies and exam. If you feel it is worth and benefit, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next a good academic video. Thank you.